Hi, I'm Dr. Alan Pearson. I provide optometric vision therapy and neuro-optometric rehabilitation services at Vision Clinics of Development and Learning with locations in Bellevue and Bothell, Washington. In this video, I will discuss the vision dysfunction called binocular instability, also commonly referred to as convergence insufficiency. Binocular instability, or convergence insufficiency, is a condition that negatively impacts more than 5% of the population. It is present in more than 30% of children who are struggling in school or reading. Binocular instability results in symptoms such as visual fatigue, eye strain, headaches, double vision, blurry vision, or loss of place when reading or doing other near-point work. Binocular instability impacts adults too, especially those who have had a concussion or an acquired brain injury. Binocular stability is the skill by which the binocular vision and eye focusing are coordinated, maintained, and adapt to stress. Good binocular stability results in continuously clear and single vision during a visually demanding task such as reading. Binocular instability refers to problems in maintaining visual clarity and/or single vision in response to visual demands. Binocular vision involves precise fine motor alignment of the eye muscles so that the line of sight of each eye points at the same object. With precise alignment, the brain can then fuse the images from each eye into a single image. Binocular vision allows us to appreciate 3D depth. When the two eyes are not aligned, we may experience double vision. Eye focus, also called accommodation, involves a fine motor muscle surrounding a lens right behind the pupil. The muscle is relaxed and the lens is flat when looking in the distance. The muscle contracts and the lens bulges when focusing up close. Without the proper muscle and lens accommodation, we experience visual blur. When involved in a complex visual task such as reading, we have to coordinate both binocular vision and eye focusing over a long period of time, while the eyes are dynamically moving across the page. A book is a flat, two-dimensional surface with high-contrast black and white symbols bunched close together. When looking at a word chunk, the line of sight of each eye has to point at the same word chunk, and the eyes need to simultaneously focus for the precise distance of the word chunk. Then, the eyes make small jumps called saccades from one word chunk to the next word chunk while continually maintaining the eye pointing and eye focusing appropriately. In binocular instability, there are moments when binocular vision and/or eye focusing are inaccurate, inefficient, or uncoordinated. Because there are neurological connections between binocular vision and eye focusing, sometimes there occurs a vicious cycle between the tasks of single vision and clear vision. For example, trying to make the words clear by focusing the eye can send signals to the eye muscles that cross the eyes. But if this is allowed to happen, it will lead to double vision. So eye pointing needs to be relaxed, which then sends signals to relax eye focusing, which makes words blurry. Binocular instability is the condition where the person cannot simultaneously maintain the eye pointing and the eye focusing. So the word chunks are almost double or almost blurry, rather than solidly single and clear for the duration of the task. This is frustrating and can be the root of symptoms such as visual fatigue, headaches, words jumping and moving, words going double at times, words going in and out of focus, losing place, skipping words, poor attention, avoidance behaviors, and poor comprehension. Diagnosing binocular instability. Binocular instability is difficulty establishing and maintaining clear and single vision in a sustained near-point task. It is therefore more frequently a problem in cultures that value and stress reading academic learning and occupations that involve paperwork or looking at computer screens for most of the day. Some children or adults do not report a lot of problems or symptoms because they have learned to avoid near-point vision tasks. But avoidance can lead to poor academic achievement or a different career path compared to finding and addressing the vision issues early. A functional vision evaluation is necessary to diagnose binocular instability. Regular routine eye exams emphasize eye health and eye optics, and often do not delve deep enough into functional vision in symptoms unless the patient specifically expresses problems and asks questions or has concerns. While being able to clearly identify small letters on a card means eye focus is happening at that moment, it doesn't mean that eye focusing is working well over an extended reading task. In order to function well, the eyes need to be healthy, and any need for eyeglasses should be taken care of. Next, a functional vision evaluation will take an in-depth assessment of binocular vision, eye focusing, and eye tracking in the context of the visual challenges the individual faces in development, school, work, or recreation. A functional vision evaluation looks at abilities to maintain single and clear vision over time when involved in a dynamic vision task like reading. Only an eye doctor, optometrist, or ophthalmologist has the tools to perform a functional vision evaluation and diagnose binocular instability. Not all eye doctors have the interest or training to perform a functional vision evaluation. If you are living in the Bellevue or Bothell, Washington area, you can schedule a functional vision evaluation at the Vision Clinics of Development and Learning. If you are viewing this from a distance, then the following directories can be helpful in locating a doctor who can perform a functional vision evaluation. For more information about the Vision Clinics of Development and Learning and our treatment for binocular instability or the other functional vision issues that we treat, please visit www.visioncdl.com. You can give us a call at 425-213-1016. Thank you. Okay.